Also joined now by Dr. Abdul Ansari, Director Critical Care Services at the Nanavati Hospital in Mumbai. Great to have you, Doc Ansari, with us now. We were there, NDTV crew, filming at Nanavati some weeks ago. At that time, your ICU was your COVID ICU was full to the brink, a lot of pressure. How are things now, Doc? Is it still a lot of pressure? Is it a little better?
So, Vasu, the pressure is still very, very high on the intensive care sector. And maybe because of the opening up, the government has been very proactive, has been chasing the virus. And we have been managing mildly symptomatic and moderately symptomatic individuals in better setups like designated COVID healthcare areas and, COVID care centers, which have definitely taken the pressure off the specialty hospitals. But nonetheless, the number of critically ill patients is still, I would say, on the rise, or at least on a high plateau. Over the last 100 days now, I would say, that we have been having dedicated COVID ICUs. Our number of patients, or the fraction of the patients who are on invasive ventilator, have definitely gone up, despite we realizing that non-invasive ventilator is a better modality of care. So I would like to say that we are seeing actually a shift, a paradigm shift in the age group also, which is getting involved with severe disease. Initially, we were not seeing too many patients with the age group of 35 or 45 and less than 65 really coming with bad illnesses, which we are now witnessing. The other organ dysfunctions are also catching up. And I think it's no more a disease which is catching only people with comorbidities.
डॉक्टर अंसारी, मैं आपसे समझना चाहूँगी मुंबई से खास तौर से कि क्या हमारे लोगों को समझ आ रहा है कि धीरे अनलॉक हो रहा है, वो भी ज़रूरत है अर्थव्यवस्था के लिए, लेकिन कैसे अपना बचाव कर सके? जिस तरह से कह रहे हैं, आपने बताया कि तमाम एज ग्रुप्स अब बढ़ रहा है ये, तो क्या आपका आंकलन है, असेसमेंट आपका क्या है?
I think we need to have much more responsibility in the public sphere, which is definitely better than what it was before. So I do want to say that you look around and you see people wearing masks all the time who didn't do that. They are trying to always carry some kind of a sanitizer. They are following the social distancing much more easily. So I think I'm sure this disease has changed the concept of public health for all of us, especially in India. But nonetheless, the change is probably not sufficient enough, or the quantum looking at the burden of the disease is still very poor. अभी भी मेरा ऐसा मानना है कि हमारे पास जो education है to understand what are our basic defense mechanism of proper cough etiquettes, hand hygienes, distancing, not moving out unnecessarily if not required, working from home, is still not percolated down, probably to all the strata. Yeah. I would say we still need to work and probably partner with some NGOs in this. And probably this is one of the best attempts to make it happen with all the people, realizing that it's a fight that we all are involved in, not just the doctors or the police people or the, Safai Karamcharis.
Yeah. Right, sir. Well, thank you so much for sharing those thoughts with us. The battle is far from done. We need to keep fighting. Absolutely, sir.